that have, for those that have questions, we actually have time for a panel discussion, we're calling it. And what I would like to do is have Tom come up and join Keith. And I thought I would also ask Tyler, if you want to go ahead and come up, you may have some input too for this conversation. And basically, we're open to any kind of questions you want to ask on CT protocols, dose. What do you see when you go out into your facilities? What do you want to see in your facilities that you're not seeing when you're doing inspections?
Hey, Keith, just a clarification. Would you, the CT protocols that you discussed, they are up, they are the ones on the AAPM website as well as Image Gently, or are they only up on Image Gently?
They're only up on Image Gently. It does turn out that the one pediatric protocol that's on the AAPM site is for heads, and it uses the algorithm that's on the Image Gently website. So the only pediatric protocols on the AAPM website right now are heads, and they do use the same science as the Image Gently website. And none of the Image Gently protocols are anywhere that I know of within the AAPM's website.
Okay.
Currently.
And also, regardless of the protocols up on the AAPM website or the Image Gently website, they are publicly available.
Well, certainly, yeah. I know the AAPM ones are, and so are the Image Gently ones. All you have to do is go to the Image Gently website and find the protocols, and you can download the tables. Actually, I meant to put it in my presentation, and I forgot to. There's 10 typewritten pages on the Image Gently website that talk about some of the things that I've talked about this morning to help people know how to use the tables. In addition to that, there are 2 review papers that are published in Pediatric Radiology, and one of those papers addresses what I talked about at 8 o'clock, and the other paper addresses what I talked about just now. And that's in supplement, if I remember correctly, that's in supplement number 3 of 2014. Image Gently did a program on updated CT, and basically I gave these 2 lectures at that meeting, except they gave me 20 minutes for each one. So you can imagine how concentrated that might have been. So, you know, there are other resources out there that if you have questions, you can go to.
Keith, if it's all right with you, I'll add the link to your last thank you slide, and then they'll have the link reference when we post the slides.
Okay, all right.
I was just going to follow up real quick.
Just a minute. I had a question as to when the slides will be posted. We have captured this entire session like we do for every year's training so that those here as well as those not able to attend can go back and look at them. It's taking us, I think, about 30 days now to get up a new program or less. So they go up very quickly on the AAPM website, and then Bruce will be posting PDFs of the static PowerPoint images on the CRCPD website, and I don't know how long it will take him.
I was just going to follow up on what your last question there. Couldn't you take the AAPM adult techniques and apply the tables from the Image Gently?
I don't know to what degree they chose to reduce. Well, yeah, the adult ones should work. Yeah, because the adult information on Image Gently should be consistent what's within the AAPM. Yes. Because I keep thinking that everything on the AAPM website also addresses kids, and obviously it doesn't. Just the heads. Yeah?
One thing I don't understand is that when you decrease KVP and you amped up the MAS, in order to maintain the image quality. And you mentioned that the dose to the patient would be reduced. And that part I don't understand, because if the KV is reduced, then that means more photoelectric effects taking place and fewer of the scattered radiation be escaping or produced and escaping from the body. So that being said, why would the dose not be the same?
If you reduce the KV?
Yeah.
Yeah, if you
More
reduce,
photoelectric effects
if you
taking
reduce the
place.
KV, the dose is less, and you got to increase the mass.
Right, I understand that, but the overall dose is lower. With this, with these technical factors, why would it not be the same if the image quality is the same? Because you're adjusting both lowering the KV, increasing the MAS, so you have more of the photoelectric taking place and fewer of the scattered radiation being generated because your contrast is going up.
But I'm ignoring that when I keep the dose the same, and I use that approach. Because I didn't, remember, when I set my lower KV
Right.
and matched the dose, I just totally ignored what was happening with the image quality.
But you mentioned that the image quality is the same then in your slide.
In the second case, I gave
Right.
I gave you two approaches.
Right.
One approach is my target is same dose with lower KV.
Mm-hmm.
The other approach is my target is same image quality with lower KV. Okay? So my targets are different.
Okay,
So the protocol is different.
all right, thank you.
It's a good example of what I said at the very beginning of the lecture. It's easy to tangle this stuff up. And so, you know, we highly recommend that if you're going to get into this kind of stuff in CT, that you get a good qualified medical physicist to help confuse you.
Any other questions?